Um, Commissioner Chung,
Present.
Commissioner Guillermo,
Present.
and Commissioner Chow.
Present.
And we'd like to do a land acknowledgement before we start the meeting. The San Francisco Health Commission acknowledged that we are on the unceded ancestral homeland of Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in this traditional territories. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. Thank you.
Shall we move on to the second item?
Please do.
Sure. Item 2 is the approval of the minutes of the August 3rd, 2021 Finance and Planning Committee meeting.
Do we have a motion?
So moved.
I'll second.
Okay, can you do a roll call?
Oh, sure. And I'll note there's no public, there's no one on the public comment list. I'm sorry, on the line. So Commissioner Chow,
Yes.
Commissioner Guillermo,
Yes.
and Commissioner Chung.
Yes.
Great. Thank you. The item passes. We can move on to item 3, the monthly contracts report. Ms. Ruggles.
Hi, everyone. All right, I have 2 computer screens. I feel like I need 4 for all these documents. But all right, so we'll start with the first contract, Haluna Health, ELC Enhanced Detection. This is a new grant that we have, and so this is a new contract. And so we're asking for retroactive approval with Haluna Health, who provides the programmatic administration support for the services that are to be provided through this grant. The term of this agreement will be from January 1st, 2021 through July 31st, 2023. It's 2 years and 7 months. And this is retroactive just simply due to the competing contract office requirements with the additional COVID contracts in the past year. And so that's why this one is retroactive. But we wanted to still bring it to you in lieu of providing a list of COVID contracts whenever possible. We have staff here if you have specific questions about what exactly is being provided through this contract, if you'd like to learn more about these COVID services.
Any questions, commissioners?
I just was reading again. My question is, what is the difference in the fund between Enhancing Detection Month and Enhancing Detection Expansion Month?
I don't know. Is Dr. Phillips here?
Is in the room.
I am here. Good afternoon. Hi, everyone. Hello, commissioners. Well, what I could say is that this funding is federal funding. It came in waves. And so they gave some initial portions of the money, and then they expanded some of the areas where they were asking the local jurisdictions to focus. And this is all done sort of coordinated through the state health department. So CDPH then helps us keep track of the areas under the CDC grant that we are working in, and so that is the reason why there are several of these. The money came out at different times, and they have slightly different intervals in which they are to be utilized.
No, that's fine. Thank you.
Any other questions, commissioners? Ms. Roco, maybe we can move on to the second contract.
The next question, the next contract is the Harm Reduction Coalition, and what we're here today for is approval of an amendment. And this requested action would allow us to extend the term and within that term add the additional funding that's been added to this contract to support the programs that they have, which includes one-time mayor's funding to enhance the drug overdose prevention and education project, which we refer to as the DOPE project. And then there's cost of doing business that's been added each year. And then their Harm Reduction Training Institute funding. So it's fairly straightforward, but we also have staff here if you'd like to hear or have more questions specific to this particular contract. Oh, you know what? I just remembered. You did ask questions and we provided back a response. And the questions that you had asked was about the training hour and the cost for the training hour. And so what we provided back in that explanation is that the training is an all-inclusive cost that reflects $59,000 in naloxone kits and $29,000 in other supplies. So the trainings occur in the field. And so even though the training itself is an hour, there's a lot of cost for prep time, developing the training to tailor it to the needs of the requester, setting it up, registration, et cetera. And there's the funding supports 1.25 FTE.
Well, thank you. I read it quickly, and your explanation is even reinforcing that it's the whole activity, and that to me would make sense. Thank you.
And thank the staff too, that we're scrambling to. Okay.
We just have the holiday, so when we read it,
Yeah.
but that makes a lot of sense. Thank you.
Okay. The next contract is the San Francisco AIDS Foundation, which is request of an approval of a contract amendment. And in this contract, we're extending it by 1 year. This one will seem maybe familiar from last month because there's a grouping of contracts that we're continuing for 1 year in order to complete an RFP that was delayed because of COVID. So that's what that's for, and it will just continue the additional year of funding to support the ongoing services under the category of HIV testing, HIV risk reduction, and then special projects as included. And again, we have staff here if you have particular questions. I'll add, so it was a little bit generic, but when we provide the performance backup so that you can see, we provide the performance backup so that you can see how the contracts have been rated. And then also when we have a vendor with multiple contracts, we also provide a summary of that contract with, you know, all their different, or that vendor with all their different programs. So when we provided the original performance backup, it included programs that were not part of the 2 San Francisco AIDS Foundation contracts that are before you today. And so that was probably confusing, or it was to me. So you have another backup that isolates only the programs that are in this contract. But you did have a question about the low deliverables in one of the programs within the San Francisco AIDS Foundation. And so I tried to provide, well, I incorporated what the staff provided and then a little bit more background to understand how we normally look at invoices when there's low productivity and that they get flagged. And then the program manager over that contract will review the deliverables and decide if it's a problem that, you know, whatever the circumstance, they'll figure out how to move forward with that. So it's not being left and hopefully till a year later when the monitoring happens. In this case, there's a couple things going on, and one is COVID is going on, and that impacts our units of service for all different reasons. And it's hard to have one reason that is across the board, because there could be the staff could be deployed to a COVID response, no longer working in their home program. So there's a lot of variables with COVID. So we did not penalize contractors for underproduction during COVID. What we have been doing is monitoring that, and the Business Office of Contract Compliance, while they're not scoring, they're still doing the monitoring. And so they work directly with the program. There's a lot of follow-up with the program who's undergoing their own, or was, I was told, it's written here, re-looking at how their program was structured. They added a staff person, and based on what those meetings told them, there wasn't a need to put them on a corrective action plan or an ongoing plan of action. So that was evaluated, and that's how they determined that the work that needed to be done was already happening. And anyway, so to answer that question about that particular program, which is outside of the actual 2 contracts that you're reviewing today, but I will say in general, San Francisco AIDS Foundation does very well in their program monitoring across the board. But again, staff are here if you have more specific questions.
Commissioners, any questions?
Okay,
That actually was an appropriate explanation, I think, as to what's happening during COVID. So, you know, I think that's how the staff is handling it. I didn't realize, are we deploying contractor staff also during this period of time?
Contract staff have been deployed within their programs. So if we maybe moved over to do case investigation and contact tracing, sometimes in one, you know, some staff have gone to do isolation and quarantine work because they couldn't do their regular, if they had a shelter and the shelter was closed, they maybe redeployed. But what we did there was we added on to the contract a COVID cost center, but we didn't change the original contract. So there's a little bit of a disconnect, but yeah, staff have been deployed. Or, you know, also clients may not be coming in. This would be 1920, so it was the beginning of COVID where people were scrambling to figure out how to do telehealth or remote whatever services remotely. So, but yeah, to answer your question, yes, they have been deployed.
That's fine. That's a dimension I think many of us did not realize, and certainly, you know, it'd be appropriate to charge that off to COVID also. Thank you.
Right. Should I move on?
Yes, please.
Okay, the next contract is the Board of Trustees of the Glide Foundation. And again, this is an amendment. Really here, what we're doing is realigning the term. And because it's extending the term, that's why it's coming back to you. And in so doing, adding in some funding that was added in the meantime. And so it's continuing services as they've been going. I mean, the same services, sorry. And you had asked a question that was also, we responded. And that was about the LEAD grant. The LEAD grant is a piece of this program or of this vendor. So there's the PhD piece, and then the LEAD grant has been added into that contract. And the grant ran out. And so we have been using general fund to backfill it. And I didn't hear back yet if it's ongoing forever, but the contract or the program has been very successful. So I believe that it's definitely something that Behavioral Health Services is planning to continue. It's certainly extended through the term of this contract.
So thank you for that explanation.
Okay. And then the next San Francisco AIDS Foundation contract is an amendment. This contract we're bringing back, it actually hasn't been that long since you've seen it and you approved the full 10 years because we were going to the board. We then delayed our going to the board for a number of reasons, COVID being one of them. And since we didn't go right away, since that time, there's been a lot more add backs. And so we are just simply back here today to update the approval from the Health Commission or seek new approval from the Health Commission prior to going to the board. And when we go to the board, we'll be matching what is up there, the term through June 30th, 2026, and the amount of funding.
Any questions, commissioners? I think it's safe to go on, Ms. Ruggles.
Okay. Crestwood Behavioral Health. This is a behavioral health, or it's actually, well, behavioral health and transitions contract. It's a locked long-term care facility. And the purpose of this is, funny, it's not written, is a contract amendment. And it will extend the term per what's allowed in the RFP, the solicitation, and it will add additional funding to reflect what's already been included in the contract that we've been funding through the contingency. The Prop C funding, that's the ballot measure funding directed towards homeless, some funding has been added to this contract to add beds. And so essentially what you're approving today is the extension with the additional funding as described.
Any questions, commissioners? Not seeing any hands. I believe you can move forward, Ms. Ruggles.
Okay. The next contract is Haluna Health. This is approval of a new contract for 2 years, or what, 3 years? Did I get that wrong? 2 years and 11 months. Okay. So again, what Haluna Health provides is program administration and support for Department of Public Health with our COVID response to a broad range of activities related to the services and activities. And again, the Haluna Health receives 12.8% of the total. And so of the amount of $980,000, they'll receive $125,440. I think we have staff here if you have questions about this one.
Just checking. Any questions, commissioners? Okay, keep going, Ms. Ruggles. Thank you.
Okay, this contract, Baker Places Inc., Ferguson is the name of the program, which this is primarily what this contract supports. This contract had been in our previous section that used to be called Housing and Urban Health, managed by them. It also has, I'm just forgetting, used to be managed by them. And then when Housing and Urban Health moved over to the new homeless support, the new Department of Homeless Services, this contract moved to behavioral health, but it just missed a behavioral health solicitation. So what you're getting today really is just us trying to keep this moving as a new contract with an updated boilerplate under behavioral health and no longer in the section that doesn't exist. And so, so this is what it is. And we will be going out to bid for this, putting it out to a solicitation, which is why it's just a shorter term from July 1st this year through June 30th, 2023.
Can I ask, why did, how did they miss the, guess the application deadline for the,
Oh,
Board of
it wasn't Baker that missed the application deadline. It was that the like planning hadn't occurred where it was being transitioned from one section of DPH to the responsibility of behavioral health services. So it had never been one of their programs. And when they set up and issued their RFP, it preceded this contract becoming owned by behavioral health services. So because of that kind of disconnect, it's been brought over from a management perspective now, but we let it run out its old term. And so that term ended, and now the new term is officially with behavioral health services, and it's on the behavioral health services. There's a slightly different contract format because if it's under BHS, it has to have a cost report. So it's now fitting into all the requirements of Medi-Cal and whatnot. But they own it. I mean, you know, it's a program location that includes part of this is a good, did they call it transitional residential, but treatment program. So we wouldn't get rid of this program, or we wouldn't, there would be no point in having a gap in services. So we're continuing it under a sole source with behavioral health services, and then we'll go out to bid, do a solicitation for which they'll be eligible to apply.
Thank you.
Commissioners, okay, move on to the next contract? Okay. Move on, Ms. Ruggles.
Okay, so this contract with the San Francisco Public Health Foundation is new, but for continuing services. So this new contract agreement for $9.5 million will go through July 31st, 2024 for a total of 3 years and 1 month. And this is a continuing PhD food security program that was previously solicited under RFQ 22-2013. And what the Public Health Foundation does for us is in its administrative role is they then conduct, okay, sorry, I got ahead of myself. They provide the administrative management for the multiple subcontractors that this program brings in to make sure that they're able to provide their services at the community level across San Francisco to address the food security issues through this food security program. And the San Francisco Public Health Foundation provides the administration and various components of the program. And I believe we have staff here if you have questions.
Just I guess it's a technicality. If it's a continuing program, but this is a new contract with the Public Health Foundation, who administered the services, or who did the services previous to this contract?
That's a great question. Often I think it's the same, they did it before, and then it goes out to bid. And if they get selected again, then it becomes a new contract for continuing services.
That's exactly right. This is Paula Jones from Population Health. That's exactly what happened.
Okay, great, thanks.
Great. So, commissioners, all the contracts in the contracts report have been presented. Any final questions before you consider a vote to recommend it to the full commission? I'm noting there's nobody on the public comment line to ask any questions.
So I would then move to approve the contract report.
I would second.
I'll do a roll call vote. Commissioner Guillermo,
Yes.
Commissioner Chow,
Yes.
and Commissioner Chung.
Yes, so
right.
this will go to the consent calendar.
Thank you, Ms. Ruggles, and all the presenters, or all the people who are here to answer questions. Item 4 is a request for approval of a new contract with SpendMend LLC.
I think the staff should be here. I'll just introduce it while we're waiting. This is a request for approval of a new contract with SpendMend LLC to perform 340B drug pricing program consulting services. And this contract would be $427,840. That includes the contingency of 12% and a term of October 1, 2021 through September 30th, 2025. And do we have?
Hi,
Yeah.
this is Steve Patel. I'm the interim director of pharmacy at Zuckerberg San Francisco General Hospital Pharmacy, and I'm here to represent this contract. This is actually a contract as a replacement vendor. So we had a vendor for the last 5 years doing external auditing for our 340B drug pricing program. The 340B drug pricing program is a federally funded grant program awarded to covered entities that service the underserved population to provide deeply discounted drugs below, manufacturer cost. The HRSA, who has direct regulatory oversight over the 340B program, requires that each covered entity have an external auditor to audit all of the patient records and drug purchasing records and provider records to ensure that the covered entity is compliant with the program rules and there is no fraud, waste, and abuse that is occurring. And so we went out for an RFP and we've onboarded a new vendor, which is SpendMend.
Any questions, commissioners?
I actually had a question, and I may have my information wrong, but is the 340B program, isn't there a proposal or a policy proposal at the federal level to either get rid of this 340B program or change it? And if so, will that affect this program as well into the future?
So for the last about 5 years, there has been a lot of talk at the federal level to either eliminate the program or change some of the program rules due to drug manufacturer concerns for fraud, waste and abuse on the covered entity's part. It's still sort of in talks and discussions, and of recent, many manufacturers have actually pulled out of the 340B program, leaving covered entities like ours at the Department of Public Health to, not be able to participate with those drug manufacturers to get those substantially reduced pricing. And then just to answer your question, for now, because there isn't any sort of global decision as to if this program is going to cease to exist, since we are still able to get 340B drug pricing from majority of the manufacturers, we are complying with HRSA's sort of requirement to continue to have an external auditor until we're advised otherwise.
Thank you.
Hey, good afternoon. This is Rich Iverson with SpendMend as well, so I'm available for questions. and Dr. Patel is correct. They have limited the scope to what is known as contract pharmacies, meaning the pharmacies in the retail community that you deal with. They haven't really affected pricing to the hospitals themselves at this point. Currently, there's 7 manufacturers that have been denied pricing to those retail pharmacies. So hopefully the scope is limited to that. It's probably gonna end up in the courts at some point, but Dr. Patel is right. The program is going on as intended, and hopefully it will go as intended in the foreseeable future.
Thank you. Any other questions, commissioners? There's no.
But thank you for that reassurance. Like 340B is a very touchy subject at the moment. So
It really
glad
is.
that we have a plan forward.
Agreed.
So if there are no more questions, if commissioners, if you would consider a motion to add it to the consent calendar, we can move forward.
I'll move to approve.
I'm second.
I'll do a roll call vote. Commissioner Guillermo,
Yes.
Commissioner Chow,
Yes.
and Commissioner Chung.
Yes, and I assume there's no public comment on this.
No,
item?
there's no one on the line.
Thank you.
Great, thank you. Item 5 is emerging issues.
My issue really isn't emerging, but it's asking. I know several years ago, Ms. Ruggles actually gave, I think, a good summary of how many of our different contracts that serve various, I guess, various problems interacted with each other. And so looking at, for example, the SFA's Foundation, which does a great job, they have a large number of contracts that cross many different I guess modalities or specialties, and some are in behavioral health, some are in housing and so forth. I'm wondering if we could ever get back to, once we have adequate staff, to get back to being able to look at the entire ball and say which ones are doing what, so that within, say, the HIV probably is the easiest, but if we use that, then there are 4 contractors doing 25 projects for the big topic of HIV. I don't know what the topic should be, but it seems to me that we see a lot of different contracts which are serving the public, and we see them, down at the micro level right now. But it'd be nice to have an overview again of how they all interacted, and that they're not conflicting, but they are, well, they're interacting and complementing each other.
Yeah, one thing we try to do, because I completely agree, it's a little out of context when you get contract sort of randomly, is that what we are trying to do is take when we had an RFP, which presumably covered a service, was then to explain that whole service at the same time and who was awarded, and kind of make that the point in time where you got the overview. But we can definitely revisit how to do that again. That seemed like the best time, because otherwise the contracts aren't all tied together in your approval path. But that we haven't had that during COVID. So I could look at when the RFPs are coming up, and maybe just have to think some more about how to do that. But yeah, for sure, could do something like that. I also I forgot to mention that from your prior meetings and discussions that you've been having with Dr. Bennett about equity, I wanted to let you know, and we had talked about this, and I think, in fact, the commissioners had brought it up, that how are we looking at equity in the contract programs? And so Dr. Bennett is beginning to pilot a tool to be used to look at how a contractor is meeting objectives. And so next month, she's planning to have the Glide Foundation that you saw today, bringing that back, using and applying the tool. Excuse me. And then you'll have a chance to weigh in on that. But I forgot I wanted to mention that come in October.
Thank you, Ms. Ruggles. And I have some, going back to Dr. Chow's question, I have some thoughts about how the RP and the service stuff can be presented. I'll talk to you offline. Any other comments about this issue or any other things under emerging issues, commissioners?
Well, Michelle did bring up Dr. Bennett's point, presentation, and I'm hoping, I know there are more resources, but that the implementation of these tools or different evaluation processes are going to be better than how well we've done with the cultural competency, which over a number of years, I think we struggled with different processes, but I don't think we ever gave it sufficient support. So I know Dr. Bennett has a tremendous support behind her, and so I'm looking forward to that.
Great, I'll let her know. Thanks, and thank you, everyone.
The next item is public comment, and there's no one on the line. So Finance and Planning Committee members, now is a chance to consider adjournment, but we need votes for that.
I'll move to adjourn.
Oh, I don't know. I mean,
We went too
I guess there's
fast.
a long meeting coming up later, so I will second the motion for adjournment.
Okay, then we'll do a roll call vote. Commissioner Chow,
Yes.
Commissioner Guillermo,
Yes.
and Commissioner Chung.
Yes, that's a very short meeting. Thank you, and see you at 4.
Productive, very highly productive in a short time. Thank you all.
There's
Okay,
good
bye-bye.
information